Saseni mkofiti, karibuni sana. Aki nimewamiss. I know it's been a while. Nimekawia sana hapa, but it's because of 1, 2, 3. But I'm so glad to be back. Nimewamiss. I know you guys can feel the energy. I'm excited. I'm like, yeah, I'm finally doing this. It's been a very rough season for me, but I thank God even for strength to be able to sit here and give you guys insight. If you're new here, hata before nionge sana, this channel inaitwa Lilian's Insight channel. Here we give insight, God given. It's a God inspired channel that gives insight on various issues about society, kama vitu kama anxiety, vitu kama insecurity, vitu kama purpose. Those are the previous videos I've done. You can head over there to watch them so that you can know more about what I'm talking about. So guys, without further ado, hata kabla hatujaanza the topic of the day, please, if you have not subscribe. You can also hit the notification bell so that you can be notified of any time that I get to make a new video. So you guys, leo ni class. Tuko class. Hii inaitwa insight. So I want to give you guys insight on the topic I want to talk about, and it's kind of a continuation of what I was talking about, because I want to talk about mental illness and mental health. I was reading an article, and the person who wrote the article named it the silent epidemic. You know what an epidemic is. So this one is a silent one, because people day in, day out, you can be sure, are dying of mental illnesses, be it which one or which one. The ones I'm going to tell you guys about. And others are being diagnosed. Others are getting depressed day by day. So this is a topic that is this is a video that is worth listening or worth watching. So guys, before ata tuende, let's define what is the types of mental illness. Then now we can go and share. Leo nitawaambia mpaka how to care for someone who has been diagnosed with this. Watu wengi hawajui. Mtu wetu tuseme ako na ugonjwa ya depression, utamhandle aje? Mwingine maybe ako na psychotic disorder. How do you love and care for these people? So types of mental illness. Number 1, kuna mood disorders, and these are disorders such as depression, bipolar disorders. Number 2, kuna anxiety disorders. These are personality disorders. And number 3, kuna psychotic disorders. These are schizophrenia, kama schizophrenia hivi. And each type of mental illness has a different set of symptoms. Poleni mtani correct too. It has a different set of symptoms. So those are the ones that I've noticed, and one of them, the most common is depression. You know about depression because this one affects the mood and the behavior of a human being. And then easy kama schizophrenia ni kuona vitu haziko. Me even ndo naweza define in layman's terms. Na anxiety kuna personality disorders, such things. So signs to look out for of mental illness. Tuende number 2. One of them is unusual or illogical thoughts. Yani unakuwa na mafikira zenye si za kawaida, unaona vitu si za kawaida, kama schizophrenia, kama hallucinations. Number 2, kuna unreasonable anger or irritability. Yani ukikasirika all of a sudden unakuwa tu irritated, umekasirika. Unajua kuna kukasirika ile yenye ni ya kawaida, lakini kuna ile kukasirika yenye inakuwa extreme. Alafu number 3, kuna poor concentration and memory, not being able to follow a conversation. So if you have a poor memory, unafikiria tu ni kusahau vitu, be very careful and check yourself. One day when I'm ready, I will tell my story. And then kuna hearing voices that no one else can hear. I know iko kwa schizophrenia. Kuna increased or decreased sleep, kuna increased or low appetite, kuna lack of motivation, kuna drug use, kuna suicidal thoughts, kuna being obsessed with a topic, e.g. religion, such things. And kuna underperforming in school or work performance. Hizi sasa ni za watu wenye wako shule. So those are some of the signs that you can look out for when you see or when you're talking about mental health. And then the next one, we can now go about the causes of mental health. Zingine such as genetic factors, but that doesn't mean because one family member has a mental illness, others will. Kuna drug and alcohol abuse. This can trigger manic episodes like bipolar episodes. Yani kutumia drugs zinaweza changia episodes kama bipolar and such. Kuna other biological factors kama hormonal changes. Alafu kuna early life, yani like environment yenye mtoto alikulia inaweza changia kupata mental illness. So these are, I want us to brush quickly ndo I don't want to lengthen the video msiboeke. Alafu number 3, that was 2. I want us to talk about which is the most important video or part of this video, how to care for someone who has been diagnosed with a mental illness. Mtu ame experience psychotic attack, mtu ako na depression, mtu ako na bipolar, mtu ako na stress and such other things, ama food disorders, kuna anorexia. How do you care for such a person? The number 1 is to love them. You should care for them. Let's love these people. Kuna wengine ukiona kazi ama mtu mwingine amediagnoziwa na mental illness, we unawatenga ama unawasema vibaya, hiyo muache. Love them. The way you can changia kwa kupona kwa mgonjwa ni kumpenda. Number 2, educate yourself about the illness. That is why this video is very important. Jua about the illness. Kama ni about bipolar, know about it. Know how to handle in the event the person has an outburst, in the event you hear, someone is having hallucinations. How do you handle it? They say knowledge is power. When you educate yourself, you are able to care more about your mgonjwa or about the victim. And then number 3, kuna gani? Kuna find support groups to help us lessen the burden. It's not easy to be a family member or a loved one of someone who is going through mental illness. So what you can do, find a support group. Kuna mingi, mnajua mkiwa wengi, a problem shared is a problem solved. Mkiongea, you discuss your issues, it helps to lessen the burden. Number 4, take care of yourself as you care for those people. If you care for a loved one who has been diagnosed with a mental illness, even you take care of yourself. Eat well, make sure you sleep, don't stress yourself, because sasa if you stress yourself, mtakuwa wagonjwa wawili, and it will not be good, and will also stress the other person. And also, if you sense any danger, run away. Sometimes when you go through or when you're with a victim or a patient of mental illness, there can be dangerous, like such as outbursts. Nimewa explain hapo before kuna outbursts. So take care of yourself. Ukiona kitaumana, we toroka and run for your life. So kuna nyingine, don't avoid blame and neglect. Don't blame the person. Mwanze kusema hii ni familia yake, ni huyu alifanya, alileta. Don't blame them. There's all this I'm talking about. The main one is loving these people. My point here, in fact, is to love everyone that is being diagnosed with a mental illness, and shout out to them that have been there for patients. Someone has been diagnosed with anorexia, someone is depressed, someone is suicidal, someone is experiencing hallucinations because maybe drugs or any other thing. Shout out. Yani nyinyi hata wacha niwapigie makofi kwa wale mmependa hawa watu. If you love them, you are a good champion. And also push for reforms. This one now is also another point. Push for reforms, because if you have experienced these things, for one, I know directly and indirectly that mental health is very expensive in Kenya. So one way we can do or we can help patients by maybe your patient can afford, but others are not being able to afford to access the health care or to access the treatment that they deserve. So push for reforms. If if you are able to reach out to members of parliament, to these stakeholders, reach out to them and ensure that you share your issue and tell them to make reforms. So that marks the end of my video. Sikuwa nataka kuwaeka leo, nilikuwa nataka tu to share some insight on this. But my takeout, hata kama hujaelewa kitu kwa hii yote, love people who have been diagnosed with mental health, and also talk about it. Share. You know, when you share these issues, it helps even the government, it helps the necessary stakeholders to make amends, because there is need for amending the mental state, the state of mental health care in Kenya. So guys, that has been it for today. Encourage me by commenting and sharing and liking for the next video, and I love you guys. Bye.